Welcome, everyone, and thank you so much for joining our February Wellbeing webinar called Heart Health 101. Even though we are at the tail end of the month, with February being American Heart Month, we really thought it was the perfect time to host a webinar on the topic of heart health. So I want to start out by welcoming everyone and thanking you for taking the time out of your day to join us here today for our second Wellbeing webinar series that we have launched this year for our members. My name is Katie Keller-Burgess, and I am part of the Wellbeing team here at Univera Healthcare. So I will be the host for today's webinar, teeing up our guest speaker, Dr. Erin Conway, who will be presenting our Heart Health 101 webinar, going over some practical tips and strategies that you can use to show your heart some love. So a few housekeeping items that I do want to start us off with here today. First off, please note that today's webinar is being recorded, along with all of our 2025 Wellbeing webinars, and they're being housed on our Univera Healthcare YouTube page. So if you need to go back and listen to this webinar, or maybe access a past or future webinar that you are not able to attend live, you will have on-demand access to these monthly webinars right on our YouTube page. Another housekeeping item that I do want to call out is that all participants' microphones and cameras are automatically disabled. There will be time at the end of the webinar for questions with Dr. Conway. So if you do have any questions at any point throughout today's webinar or the information that's being covered, please feel free to enter them into the Q&A feature, and we will go over questions at the end. So at the top of your team's webinar, you should see that Q&A icon. So if you click on that, once again, feel free to enter any questions that you have at any point, and we'll get to them at the end. And lastly, and most importantly, it is important to note that the content covered in today's webinar is simply educational in purpose. So if you have any specific health-related question or concern, we do recommend that you connect with your primary care provider, or if you have any benefit-specific question or concern, we do recommend that you call the customer care number that's on the back of your Univera Healthcare member ID card. All right, so with that being said, I have the distinct pleasure of introducing our guest speaker here today, Dr. Erin Conway, who has been with the health plan as a senior medical director for over 3 years now. She is board certified in internal medicine as well as pediatrics. She graduated from the University of Rochester and obtained her medical degree at the University of Buffalo's Jacobs School of Medicine, where she was class valedictorian. She has completed her Med Peds residency at University of Cincinnati and Cincinnati Children's Hospital Medical Center. Now, she has practiced medicine in a variety of settings in Cincinnati and Buffalo and maintains clinical practice in internal medicine at Buffalo General Hospital. She has worked extensively in medical education, previously serving as an associate program director at the University of Buffalo Internal Medicine Program for over 100 medical residents. She has taught quality improvement, patient safety courses to physician trainees. She is published and has presented nationally on a variety of topics and has also been a physician advisor for our utilization review. Now, this is only a small showcase of all the great work Dr. Conway has done and provided to our communities. So we are so thrilled that she is able to be here with us today and facilitate once again our Heart Health 101 webinar. Dr. Conway, once again, thank you, and I will turn it over to you.
Thank you so much, Katie. It is a pleasure to be here today with all of you. This is a matter that is in a topic that is near and dear to my heart. There is a little bit of pun intended, but it's certainly an important topic. So thank you for setting us up. And I look forward to taking the next 30 minutes or so and telling you hopefully all you want to know about heart health. We'll start off by going into an overview and then into more detail about the factors that go into heart health. And I hope to help each of you understand your risk of heart disease. We'll talk about preventative measures, ways to support your heart health, And very importantly, those red flag concerning signs and symptoms. And then we'll wrap up and end with resources and related benefits through Univera. So we'll go ahead and get started. So why this is important and why we're talking about it today is because heart disease is a leading cause of death in the United States. Yes, that's both for men and women. And yes, heart disease beats out cancer. It's always been at the top or near the top of leading causes of death. As a matter of fact, one person dies every 33 seconds from cardiovascular disease in the United States. It's very prevalent. And when I say heart disease, I am referring to several types of conditions. Most commonly, coronary artery disease. And as you may know, our coronary arteries are the vessels that bring blood to and supply the heart muscle. And a lot of people don't realize this, but coronary arteries, they are only about 3 to 4 millimeters in diameter in a typical adult. And so that's the diameter of something like your smartphone charging cable. It's slightly smaller than the end of a pen or a pencil eraser. So our coronary arteries, they are relatively small, and they certainly change over our lifetime. Coronary arteries are susceptible to atherosclerosis. That's the hardening and buildup of plaques and blockages of cholesterol, calcium, and fat. And again, coronary artery disease is the most common cause of heart disease. Next, atrial fibrillation. This is the most common cardiac arrhythmia or heart rhythm problem. So that's a problem in the electrical system of the heart, where the atria, which sit at the top of the heart, the two chambers at the top of the heart, they fibrillate and they shake, and they don't allow then the heart to function regularly, which can lead to heart pumping problems and blood clots or even strokes. Cardiomyopathy. This is a group of diseases of the heart muscle where the muscle itself is structurally and functionally abnormal. There are certainly other related conditions like heart valve conditions, but these three above are really the main conditions. And again, what I'm referring to when saying heart disease. So with improvements in medical care and people addressing and reducing their risk factors, that has led to declines in mortality in recent years. But again, heart disease is still the leading cause of death in our country. So we've done an overview of heart disease and the prevalence. And so now what is heart health? It's always more fun to talk about health, and health being the opposite of disease. So these are the factors involved in maintaining and reducing one's chances of getting heart disease. And we'll go through each of these now. First, understanding your risk for heart disease. Outlined here are the key risk factors for heart disease, and notably, about half of all Americans have at least one of these risk factors. These are also all things that you can affect, manage, change. You do have the ability to intervene on these three risk factors. But starting off with high blood pressure. High blood pressure is when the pressure in your arteries and vessels is too high. When it recurs repeatedly, a diagnosis of hypertension is made. And high blood pressure in your arteries harden and stiffen those vessels over time, and they also cause changes within the vessels that accelerate the buildup of plaques and atherosclerosis. And again, this happens throughout the body, can happen in any of the blood vessels. But when it happens in your heart and brain, it greatly increases the risk of heart attacks and stroke. Next, another risk factor, high cholesterol. Cholesterol is taken in mainly through what we eat, and it's also affected by alcohol use and how much we exercise and some of our genetics. But cholesterol accelerates atherosclerosis throughout our blood vessels. And to use a metaphor here, if arteries are like pipes, then high cholesterol and atherosclerosis is a buildup along the walls of the pipe, kind of the gunk along the walls of the pipe that narrow and slow down the flow through the vessel or pipe. Smoking. Smoking is a big one. It is the leading cause of It is one of the leading cause, right at the top probably, of risk factors for preventable cardiovascular disease. The impact of cigarette smoking, it is well known, and it's well known that your risk of heart disease increases profoundly with how many cigarettes or packs per day, and that even a few cigarettes per day or secondhand smoke can still be harmful. We'll talk a little bit more about each of these later too. This next slide are the things that you can also affect and control, and these are more the lifestyles and behaviors that increase our risk of heart disease. So eating a diet that's high in cholesterol and high in fat, and really maybe a more simple way to think about it is eating kind of poor quality foods. As a general rule, the less that's done to your food before you eat it, the better it is for you. Examples of foods we want to stay away from are particularly the industry processed foods, stick margarine, commercially developed baked goods, deep fried, fast foods, like prepackaged foods, processed meats, hot dogs. That one's a hard one for my children. It's also a hard one in Buffalo and Western New York when we get to be the spring and summer. But hot dogs, bacon, sausages, those are very highly processed meats. Again, lots of things are done to them before you eat them. Along the same lines of foods that are high in, cholesterol, fat, just altogether not good for us as from a heart disease standpoint. Those that are in carbohydrate rich, very refined in starch, have a lot of added sugar. Another behavior that can increase your risk is being sedentary and not getting enough physical activity. That's certainly hard this time of year. I'm also in Western New York and a Buffalonian. Getting those at least 3 or more days a week is tough this time of year with the snow on the ground. But that is the goal, and movement is good and does decrease our risk. The other things like drinking too much alcohol, lack of sleep, these are all things we've probably heard since a young age, and we know what we're supposed to do to live healthy lifestyles. It can be really hard. It can be really hard as a lull between winter and spring, but I want to reiterate that good, healthy habits really add up. Good, healthy habits can really take you a long way with your own personal health. A couple more risk factors that are associated with heart disease are listed here. These are things that we really can't change. They're not necessarily modifiable. We can't change the families we were born into or our age. Heart disease increases as we age. We can't change our genetics. For, again, another little side comment, you can't change the gene pool that you're swimming in, and you can't change your genetic material. But all of these do play into our risks of heart disease. And I just like to say, as far as genetics and family history, that in particular, if you have an immediate relative, like a sibling, a parent, who had cardiovascular disease at a younger age, being a male that was less than 55 or a female that was less than 65, you are just by that at a higher risk of heart disease. So do make sure to get yourself checked regularly. So next we'll move on to preventative steps that you can take. And so no matter your age, checking in on your health is very important. And a great first step is choosing and seeing a primary care physician. You do want to see them as an adult regularly, at least yearly. We know that this is so important because early detection saves lives. Finding a health problem early can mean that the treatment is then more effective and influences your outcome and your ability to do well. And so routine health exams, like a yearly physical, they give you the chance for you and your doctor to talk about yourself, your individual risk factors, things like medical conditions of high blood pressure, cardiac disease, and help address those things before it becomes more serious. Preventative healthcare, again, it helps you stay healthy inside and out. You can look for not only chronic health conditions like prediabetes, diabetes, kidney disease, the other conditions already mentioned, but also your mental health. Mental health is a big part of our well-being and influences our risk of heart disease. It can also address weight concerns. And lastly, the more you know about your health and body, the better that you and your doctor can do to take care of it. So when I see people in the hospital all the time, I know that they're nervous. It's normal and it's okay to be nervous about what your results might be. But it is empowering to take control of your health, Again, it's typically better to know than not know what's going on. And if there is something concerned about, your doctor can be there to answer questions, guide you through the next steps, help you on with maintaining health and hopefully preventing disease. So this chart here is kind of broken down as far as what to expect from your primary care physician as far as it relates to your heart health. So all adults should have their cholesterol checked. The frequency of that does depend on your individual risk factors and your family history, but as a minimum, every couple of years. Some people are more often than that. And many people do need medications in addition to lifestyle interventions. Next, checking your blood pressure. This is an important one. All adults should have their blood pressure checked regularly, and I'd actually convey to you or empower you to know what that number is. Elevated blood pressure, it's anything over 130 over 80, and when it's checked again and repeated as an elevated measurement, that does start to get concerning for hypertension. Again, lifestyle interventions may be appropriate, but oftentimes medication is needed. And we know that high blood pressure, it's the quote unquote silent killer. It can be present and you don't feel it. You don't feel a lot of symptoms of it until things are really out of whack. So it is important to check your blood pressure regularly and continue to follow it and seek management if it's regularly elevated. Next, taking medications as described. You know, our bodies change over time, and what our body needs as far as medication-wise, it does change over time too. That's a key part of why those regular visits are important. And do ask questions if you don't understand something about your medication. The pharmacist is often willing to help, but it might just be, you know, a chart message or better directed to your primary care provider. But it is important to not stop taking medication without being directed by your doctor. It's heartbreaking for me in the hospital when I see someone come in with a heart attack and they stop their blood pressure medicine 6 months prior, just saying, I ran out, I didn't know I was supposed to continue on it. Don't stop taking medication without it being a conversation with your doctor and without being that direction there. Again, working with your doctor is very important and being seen at least yearly. It's often more if you do have chronic medical conditions. If you have diabetes, kidney disease, it's often more along the lines of every 3 to 6 months. But the ways that you can support your heart health, there is a variety of ways. We're only calling out a couple ways here. And just to take a moment, I know that it's hard. It is hard to keep up good, healthy habits. But like I said before, good, healthy habits really add up. Getting regular physical activity can certainly lower your risk of heart disease. It can help you maintain a healthy weight, and it does improve your overall mental health and well-being. That decreases your risk of chronic conditions or helps you better treat your chronic conditions. A minimum of 30 minutes of moderate intensity activity is recommended about 5 days a week. But even there is benefit from a minimum of 3 days a week as well. But try to move your body, move in a way that you enjoy. You know, you can't go from no activity to moderate intensity activity. It should be a gradual progression. You can do simple things to help you get be more active and move your body, even this time of year when there's snow on the ground. like walking during meetings at work, standing, changing positions, taking the stairs instead of the elevator, et cetera, et cetera. And next, onto a healthy diet. I do want to say I find it a little overwhelming sometimes to do all of these things at once, and I know others do too, but these are really a few great ways to get started, and things that are listed here. Some other tips and tricks that I think work well are use a smaller plate. We have the infographic of a plate there. Most of us adults, we eat too large a serving size. So a great way to eat healthier can just be using a smaller plate, using like the appetizer or dessert plate or like a child's plate size. And by doing that, you innately eat less. Loading up half of your plate with green vegetables or any vegetables can be a great start as well. Eating mindfully and not in front of a television or computer, having those connections and relationships that make eating so enjoyable, try to go back to that. Planning out ahead of time, it is hard. Busy families, just even needing to leave the house and go to the grocery store when there is a bunch of snow on the ground. But planning out and preparing meals like ahead of time, we know that you'll likely eat healthier. I do recommend, though, that you can start with trying to keep it simplistic. Start with 3 goals. Cut out or cut down on soda and those things that you know you do that is bad for you. Cut down on alcohol. That can be, again, a first goal. Changing to wheat bread, brown rice, whole grains. Another one can be stop eating and snacking after a designated period, like 7 o'clock after dinner time. Doing small goals and then reevaluating them in 3 months' time, that really can help you get on the right track. Just another word on eating versus overeating. A lot of people don't know this, but when you eat a large meal or when you are eating, you do sigh, and that's a warning sign that you're likely done. It's a sign from our stomach and a reflex that we're satisfied. So as much as it is important to choose healthy foods and drinks, and water being best, it's also important to not overeat and to have those healthy eating habits. Don't smoke, or if you are smoking, to quit. I've said it before, smoking greatly increases your risk of heart disease, and I counsel patients all the time that quitting smoking is one of the best things you can do for your health. Even a few cigarettes a day, a few cigarettes a week, it does still have an effect, as does passive smoke exposure or secondhand smoke exposure. Smoking does double your individual risk of having a stroke. And if you haven't started smoking, don't start. Don't add that to the mix. If you are smoking, it can take several attempts to quit. It's often 6 to 7 attempts before the average person can successfully quit. It can be a journey, but it is really one of the best things you can do for your health. It is a leading preventable risk factor for heart disease, and it's never too late to stop. We do have programs like WellFrame and other programs that we'll go on a bit later on that can help you with the resources, but this is also certainly something your doctor can help you with. I believe this is our last tip, is regarding managing stress and practicing self-care. There is a relationship between chronic stress and poor health outcomes that lead to heart attack and stroke. And stress does lead to poor health behaviors as well. So things to do to get started: incorporate mindfulness and into a regular schedule. Do things that you enjoy and that fill your cup. If it's tied with one of the healthy behaviors that we already talked about, even better. Like regular exercise, but getting that routine, not losing your routine, moving on into the spring and emerging out of winter, that alone can be success. And So I'm about to wrap up here. I'm not sure, and wanted to end with perhaps this being one of the most important slides. These here are some of the symptoms that can be warning signs and red flags for heart disease. And this is tricky. Heart disease, it can be silent. It can be different for men, women, and individuals. And I really want to go over this slide with some detail to say that take these symptoms seriously. I do hear as a doctor in the hospital all the time that people, I didn't think that was a heart attack. I didn't think that was concerning for this and that this would happen to me. So there is certainly a variety and array of what the symptoms can be, but it's better to err on the side of caution and to get checked out. When these symptoms happen acutely, and any of these listed here, you do want to seek help immediately. If you're thinking you're having a heart attack, it's certainly an appropriate reason to call 911. And I do have to express that to my own family because inevitably they call me first before they call 911. And I say, okay, let's call 911. There's a reason that you do that in an emergency. The paramedics can be there promptly. They can check your EKG, the heart wire testing that gets transmitted, and they can even send that on to the local hospital. It affects what hospital they take you to. And they can call ahead and get things activated based on them coming through emergency medical services. And as we say, time is tissue. The sooner you get to treatment, you reduce the damage to your heart and the rest of your body. And so you do not want to sleep on these symptoms. You don't want to wait and call your doctor to the next morning. I do have a handful of stories for patients where that was too late. And so this is a take-home message from the talk today. Symptoms of a heart attack. We always think of chest pain, and that is traditionally what the main symptom is. It can be more of a discomfort. It can be crushing, it can be squeezing, but it can also be a discomfort in something that feels a little bit more mild and just kind of takes your breath away. It can be less in the chest, more in the neck, more in the upper back, more along the scapula. Those symptoms don't tend to present classically for women. You probably have heard this before, maybe from your doctor or the general news, that women often perceive heart attacks as different than men. If any of these symptoms are especially associated with nausea, vomiting, or occur when you are exerting yourself, if you're shoveling snow, if you're exercising, if you're running around with your family or grandkids, that is also a warning sign. And again, acute onset of any of these symptoms, err on the side of caution and get checked out. As far as heart failure, that tends to be something that can be a little bit more chronic in nature, but heart failure often happens after a heart attack that was silent. So acute onset of shortness of breath, swelling in the feet and ankles, unable to lay flat without getting short of breath, very concerning for heart failure. And palpitations, feelings of fluttering, feelings of having an irregular heartbeat, concerning for an arrhythmia and should be checked out. Okay.
All right, Dr. Conway, that was amazing. Thank you for all of those great insights that you provided from both your practical or your clinical days. I'm sure once again you have many stories that you can allude to. So we appreciate it. So the next portion we are going to go over are some of the resources and benefits that are available to our members on Univera Healthcare membership. So I do want to call out that what we go over here today, that benefit contract. So once again, we do recommend to confirm benefit eligibility to contact that customer care number on the back of your health insurance card to see if any of these resources are available to you. So the first resource we are going to talk about is the member care management team that is part of Univera Healthcare. So we have a team of healthcare professionals, which includes registered nurses, registered dietitians, behavioral health specialists, and more, who are really all here for our Univera Healthcare members whenever you need us. So, from little questions to big health challenges, our care managers, once again, are here to help support you and all of our members at all ages at no added cost. So, our members are able to engage with our care management team to get that personal guidance and support on their well being journey, whether it be through phone, as you see with the number listed here on the slide, or you can download the WellFrame app. So, the WellFrame app is a free app that you're able to download on your smart device, and it is going to provide you instant access to a variety of resources to cover a variety of topics and conditions, some that you see listed here, including substance use, anxiety or depression, diabetes management, high blood pressure, asthma, stress management, weight loss, smoking cessation. Once again, many of those items that Dr. Conway mentioned here today. Once again, through that WellFrame app, you're able to get resources and programs to help support you and build upon those healthy habits. There is also a text to chat feature through WellFrame where you are able to get that one on one personal guidance and support from one of our care managers, whether it be the registered dietitian or that registered nurse. Once again, this team is really on the back end of that app, here and ready to support you however they can. So once again, you can download that WellFrame app on your smart device. And I do want to call out the access code to use when registering your WellFrame account is Univera Welcome, all one word, all lowercase. So I wanted to call that out. And you will need your subscriber ID that's located on your health insurance card as well when setting up your WellFrame account. So another little tidbit of helpful info to have that ready. Now, the next resource we are going to go over is Perks for You. So, living a well balanced lifestyle, as Dr. Conway really alluded to, is all about making those good choices on a daily basis. And Univera Healthcare can help you do just that with our Perks for You program. So, you're able to stay healthier for less with exclusive deals and discounts on healthy programs, products, and services at participating vendors throughout Western New York. So you're able to log in to your Univera Healthcare online member account to receive those eligible discounts at any of the participating vendor locations just by showing your Univera Healthcare member ID card. And the last resource that we want to go over here today is another program that once again does vary by contract, so be sure to check in to see if available to you. But that is our Vitalize program that is offered through our partnership with Personify Health. So Vitalize offers our Univera Healthcare members a digital home base for your health and well-being. You are able to have access to a variety of tools and support you need to really make those small, everyday changes to your well-being that are focused in on the areas that you want to improve the most. So maybe it is trying to be more physically active. Maybe it is trying to eat healthier or get more fruits in your diet. Maybe it is trying to better manage your stress levels, aren't we all? Once again, right through Vitalize, a variety of resources and tools that you're able to access to better manage any of the areas of your well being that you're looking to personally focus in on and experience the lifelong rewards of better health and well being. All right. So with that being said, once again, Dr. Conway, we thank you for that wonderful information. We are going to move over to the Q&A portion of the webinar. So as I had mentioned at the top of the webinar, there is a Q&A icon. So if anyone does have any questions regarding any of the information covered here today, please feel free to enter them into that Q&A and we'll go ahead and read them off for Dr. Conway to answer. So we'll give it a couple seconds here. Once again, feel free to enter any questions into that Q&A. But Dr. Conway, in the interim, I actually did have a question as I am an avid gym goer, if you will. And I know you mentioned with physical activity, it really is just finding a way to move your body that you enjoy. I personally enjoy weightlifting and resistance training, right? And oftentimes I feel like I'm building up so much pressure, when I'm holding my breath and whatnot, lifting weights. hopefully heavy weights and whatnot. But is there any research or anything you can share about, weightlifting and heart health? Does it help to support it because of the pressure? Is it a barrier? What are your thoughts around weightlifting and heart health?
Well, I'm very happy to hear that you are physically active, especially again this time of year. That's a great habit. Weightlifting is fine for heart health. It's actually maybe better for your bones and for some other reasons than necessarily for your heart, but it's not hurting your heart. If you're doing it and you feel good and you're not feeling, warning signs concerning symptoms, I wouldn't expect you to be. It's a great, intense activity. Um, you do want to also balance that though with getting like 30 minutes of a moderate intensity activity. Weightlifting can be a little bit more of like starting, stopping, and you still need that cardiovascular activity to really benefit your heart health. So something that keeps your heart rate up for a persistent period of time. Smart watches can be great at helping you know how effective your physical activity is. And even if you don't have a smartwatch, there can be apps that you can add to your phone. I know you mentioned some of the apps here. I think all of those can really help you know how you're doing and even help you challenge yourself.
Absolutely. Thank you. Another question that did come through is how often should we get up and move if we work at a sitting job? Any insights there?
At least every 2 hours. I have, again, a smartwatch, but it tells me when I need physical activity. I think it tells me every hour, but more so as a minimum every 2 hours. You'll never really reach your step counts or probably get enough physical activity unless you're committing a big chunk of time to later in the day if you're moving less than that.
Nope, that's a great call. And I feel like I've heard the saying that sitting is the new smoking and just being sedentary and all of the elements down the line that could be caused by not being physically active. So I know very in alignment with this. I myself personally found myself sitting way too much and working at a job desk. Or a desk job, if you
Yeah.
will. So I invested in one of the walking pads. And truly, even just going at the most minimal speed, I am able to get my step count up throughout the day. And even though I thought it would impact, my mental focus and whatnot, I actually find myself working better and being able to be more energized throughout the day with utilizing that. So I think just a great, tip if anyone is able to do so as well.
Yeah, and you heard me say earlier that good habits add up. I also would say that good habits wear off. So things like getting up and moving your body and moving regularly, that wears off on like it catches on, maybe is a better way of saying it, to the people that you live with and the people that watch you. For some of us, it may be our children and teaching them how to have a healthy lifestyle. They are certainly watching, but it can wear off on our partners, our friends, and our families. And a lot of activity is always better when you can incorporate others. Some people want it for their own mental space and their own alone time, and that's great. But in order to really kind of meet that requirement and that frequency, you often need to take people along and don't hesitate to do that. So getting up to take the dog for a walk, great. Dog needs exercise too. That can help you move every 2 hours. Just taking your kids outside. Again, variety of ways to do it.
I love that. And it really brings me to a time when a couple weeks ago I was, doing some push-ups on the ground and doesn't my 2-year-old daughter come on over, lay on the ground, start to try to push herself up. So yes, I think you're right in alignment with our kids, are watching. And the more we can show, those healthy behaviors, the more likely they are hopefully able to adopt them as well. All right. I don't see any other questions that did come through in the Q&A, but one last one for me personally, Dr. Conway. I know you had mentioned the signs and symptoms and that sometimes females don't experience them as similar to males. I'm not sure if you mentioned it, but is jaw pain typically one that is more common for females or?
Yes, it can be, again, any individual can have jaw pain, neck pain, just jaw pain, no neck pain, and it can be a sign of a heart attack. Any pain that is new and persists is worrisome.
Okay, good to know. Thank you.
Mhm.
All right. Well, looks like we are at the end then. No other questions have come through. So once again, Dr. Conway, we appreciate your expertise and your knowledge here and joining us today. We thank all of the participants for joining. As mentioned, this was recorded and it will be housed on our Univera Healthcare YouTube page within the next week or so, as well as all of the other monthly webinars you're able to access. So with that being said, thank you all once again, and I hope you have a wonderful day.
Thank you, everyone.